I'm Dr. Fritz Sutter, and today we're talking about foundation nutrients. And vitamin D, I have to tell you, I've done thousands and thousands of vitamin D levels on people. And if normal is 30 to 100, why does everybody that I see have a vitamin D level that's at or below 30? That's a good question. So I think I've seen one vitamin D level in a non-supplemented person that was in the 40s. And that was many years ago, and she was very young. So this sticks with me. We live in caves. We're out inside all day. We say we go out, but if we do go out, most of us are putting sunscreen on because everybody's worried about getting skin cancer. So vitamin D is the most common vitamin deficiency that I see out there, especially for people of color who have more pigment in their skin. I can't tell you I've ever seen, especially in an African American or a dark skinned individual, that I've ever seen a normal vitamin D in this latitude. Now we know that most of the months of the year we can get some sun, so somewhere between, say, end of April and end of October we can get enough sun to stimulate vitamin D. But in those winter months we don't get enough sunlight, even if we were exposed to the sun, to stimulate vitamin D. Now most people know, if they know who they are. If they go to Florida in the wintertime and all of a sudden they feel better, and because they're outside, it's not just because of the warm temperature. It could be because of a vitamin D deficiency or seasonal affective disorder. An interesting story was that when bears hibernate, the vitamin D levels go down in them, and that makes them sleepy and a little dopey and drowsy, so they go in a cave and go to sleep after they binge eat. Well, that sounds like a lot of Americans that I know. So I think we have to take a look at vitamin D. Now, let's talk about the form of vitamin D and what it comes in. So vitamin D is actually a misnomer. It's actually a hormone, and it's exquisitely sensitive to DNA in our body, and it interacts with about 200 essential chromosomes in our body that are so important. And it cruises along and actually heals some damage to our chromosomes in the DNA. It also, of course, everybody knows about bone health. That's pretty straightforward. But more and more literature, every week we get something else that it's associated with, improved cancer outcomes. For example, in the initial diagnosis of breast cancer in a woman, if she has a deficient vitamin D, she's at the time of diagnosis, she's 4 times more likely to have metastatic disease. So we know that vitamin D is important. Now let's talk about, I think we put that away. Let's talk about how it comes. When you look in typical bottle in the store, you'll see they're kind of bright colored, and many times they're using fat soluble oils because it's a fat soluble nutrient. They're using fat soluble oils to suspend them in. Of course, they're using pretty cheap oils. Most of the time it's soybean oil, and people wonder why they don't feel well when they take it. Ours is used with extra virgin, non-GMO, organic olive oil. That's right, olive oil. And the capsules are very easily digested. Now, the form of vitamin D, there's a couple types. The medication form or the prescription form is vitamin D2. And they basically did a chemical reaction on some oils and made cholecalciferol, which is not very well metabolized. It is a form of D2. So, but D3, which is the stuff you buy over the counter. See, the reason you can't get D3 as a prescription is because it's against the law. You can't have a prescription medication and sell it if it's a naturally occurring product. So they use D2 many times at once a week, 50,000 units, but many people cannot convert that D2 to D3, which is the active hormone. You also have to store vitamin D, and that form of vitamin D is not very well stored. We know that they measured the activity in many studies, and somewhere between vitamin D is somewhere between 3 and 9 times more biologically active than vitamin D2. Now we can measure that in certain lab studies, and most of the time we don't have to, but if someone's having struggles with that, I think it's very important to make that distinction if you're supplementing with a prescription. Now lastly, who needs this? Well, I have to say that after thousands of tests, it's just too compelling to not supplement with vitamin D. Probably one of my most frequently prescribed supplements for individuals who are not feeling very well. It helps with sleep cycles and rhythms, and actually it's been shown in mood and many other studies to help your mood and sleep, the diurnal rhythm of sleep. So think about vitamin D if you're not feeling well. It's one of the foundation nutrients that I think are most important. Look for the form of that, whether it's D3 or D2. It says it right on the bottle. Most people are deficient, and take a look at that next time you're thinking about how you're going to support yourself. Thanks for listening. Please visit our website and our Facebook page for further information on this. Thanks for listening.